Senator Hassan.
Well, thank you, Mr. Chair. Thank you and the ranking member for having this hearing, and thank you to our witnesses today. And please pass our thanks along to all of the hardworking women and men in your agencies who I know have been working virtually around the clock to try to improve our response and keep Americans safe. And Mr. Chair, I hope you and all the witnesses are healthy and safe today, as is everybody on your team. I wanted to start by echoing the comments my colleagues have made about needing leadership from the CDC and our public health experts on how we are going to use facts and evidence as guidance so that our schools and our daycares and our businesses have the information they need to create safe and sustainable plans to reopen. And of course, that means too that our testing capacity not only has to be enough, but it has to be flexible enough to meet our needs. The key distinction between South Korea and the United States is not how many tests per capita over a certain amount of time we've done, but the fact that at the onset of this pandemic, South Korea was much more able to do a lot more tests per capita than we were, and then follow that with all the other measures you've talked about, so that we continue to need to identify the need and then build our capacity towards the need, not the other way around. I wanted to start with a question to you, Dr. Fauci. First of all, thank you for your work and your expertise. I wanted to talk about nursing homes for a minute. In New Hampshire and across the country, a huge number of the deaths from COVID-19 that we are seeing have been in nursing homes. We all know people who have lost a friend or a family member in nursing homes, and the grief compounded by the fact that people couldn't be at their loved one's bedside if they died. Yesterday, Dr. Birx said that all 1 million nursing home residents should be tested within the next 2 weeks, as well as all nursing home staff. Dr. Fauci, as a short-term goal, that makes sense to me. But after that, what will the ongoing federal recommendations look like? How frequently do we need to test patients and staff on a continuing basis, and what other measures will be necessary to keep our loved ones in these facilities safe?
Thank you for the question, Senator Hassan. The general plan, as you mentioned, that was recommended by Dr. Birx is a sound plan, as you said, in the immediate. Question is, in the long range, we will have to have infection control capabilities in nursing homes that are really pristine and really unassailable. We'd have to do the kinds of surveillances and have to have the capability of, when you identify someone, you get them out of that particular environment so that they don't spread the infection throughout. So general testing for all, I think, is a good start. But when you look where you're going to go in the future, there has to be a considerable degree of surveillance capability.
Thank you, Doctor. The White House is now requiring all staff to wear masks and anyone in regular contact with the president to be tested daily. Do you think nursing homes should implement those same measures to help make sure that our seniors can get the same level of protection?
I think there should be a system in place for the optimal protection of people in nursing homes. And that would be not necessarily testing every person every day. That's one approach that might not be practical when you think of all the nursing homes in the country. But very strict regulations and guidelines about who is allowed to go into the nursing home. And the staff, I believe, needs to be monitored very carefully with intermittent testing to make sure that we don't have introduction into the nursing home of infected individuals. I'm not sure you can practically do it, testing every day. That I don't think would be feasible, but something that is much more aggressive than has been done in the past, I believe should be done.
Well, thank you. I have one last question for Dr. Fauci and Dr. Redfield. I would also just say that if we are able to get masks to everybody in the White House, I hope we can get masks to every nursing home employee who needs it. Dr. Fauci and Dr. Redfield, the U.S. needs to be preparing now to ensure that we have capacity to manufacture and administer vaccines, something you've both touched on, both for an eventual COVID-19 vaccine as well as other illnesses such as the flu. The failure to ramp up production of testing and personal protective equipment early on during this crisis made things worse here, and those mistakes can't be repeated when it comes to vaccine production and distribution. We are already seeing reports that some children are not receiving routine immunizations as it becomes more difficult to access in-person care. Dr. Fauci, what steps do we take now to ensure that we have sufficient manufacturing and distribution capacity for a COVID-19 vaccine without putting at risk our capacity to manufacture and distribute other important products such as the flu or measles vaccine? And my follow-up question to Dr. Redfield would be what efforts are underway at CDC to ensure that all routine vaccines are accessible during the COVID-19 public health emergency?
Yeah, thank you for that question, Senator Hassan. I'll answer it as quickly as possible. I alluded to this in my introductory remarks when I was talking about vaccines for COVID-19. And what we said that as we do the testing on these vaccines, we are going to make production at risk, which means we will start putting hundreds of millions of dollars of federal government money into the development and production of vaccine doses before we even know it works. So that when we do, and I hope we will, and I have cautious optimism that we will, ultimately get an effective and safe vaccine, that we will have doses available to everyone who needs it in the United States, and even contribute to what is the needs globally, because we are partnering with a number of other countries. The other part of your question about making sure that when we get into a situation like the so-called shutdown that we might be in now, that we make sure that children get the vaccinations that they need, because that would be an unintended consequence of shutting down as we are right now. It's a very good point, and we want to make sure we don't fall behind on that also. Thank you.
Thank you very much. And I'll take my answer from Dr. Redfield offline. Thank you so much for allowing me to go.
Thank you, Senator Hassan. Senator Scott.